So healthcare-associated infection, as I said, is a really key issue. But it's just one of the many, many risks in healthcare. But there's no question, the perception is that it is a very serious risk and it's of great concern to patients. And as, again, Brian suggested, too many people are dying from preventable healthcare-associated infection. So none of us will make any apology for the emphasis we're putting on improving the situation on infection and on applying better controls, whether it's through the code of practice or guidelines or whatever. Part of the underlying issue is that although the principles of prevention control are relatively straightforward and understood, some trusts are really struggling to get to grips with it. I mean, it's taken a long time really to start bringing the MRSA figures down, and hopefully that trend will continue. But as you saw from the near doubling of C. difficile cases over the last few years, it really is a massive problem, with what 1 in 250 death certificates in England citing Clostridium difficile on the death certificate. What we're doing now and going forward, builds on things we've done in the past, where nearly 2 years ago now, we did a snapshot, a series of national inspections to look at this issue of hospital cleanliness. If you remember, the last general election was in part fought on a platform of how hard is it to keep a hospital clean. I mean, there was grave public concern about cleanliness. We've also, we're building on the lessons that we found at Stoke Mandeville, where we did a kind of detailed investigation of Clostridium difficile infection. And where does all this sit politically? Well, when the then minister responsible for this area, Andy Burnham, was in front of the Health Select Committee back in October, just after the Code of Practice came into being, this is a direct quote from his transcript of evidence. "I think infection goes to the heart of public confidence in the NHS. From the chief executive level downwards, there should be leadership, and it should be a priority for every single organisation in the NHS." And that's not, I mean, this is the lead up to the kind of professional letter that Brian talked about in December, and the fact that healthcare-associated infection is one of the 4 top priorities in the new operating framework for the NHS this year. Andy Burnham also went on to express a concern that there was too much variation in performance. And I think this is a very important point for us, that some organisations are motoring along quite well and are definitely making progress at improvement. Others really are struggling. And that really is an issue. What do we do about that? So let's just look briefly at what the Health Act 2006 did. Now, I've put up here part 2 because it's important to recognise there was actually a part 1, and that was the little issue of banning smoking in public places. Okay, so that probably got just about the kind of the lead. It got part 1, but part 2 came along behind, and it was this a number of clauses to deal with infection. What the primary legislation did, it gave the power to the Secretary of State to introduce the Code of Practice. It put a statutory duty, a legal duty, on NHS bodies to observe the provisions of the Code, to comply with the Code. And that's completely new.